Hydrochlorothiazide, or HCTZ, is a commonly prescribed medication that belongs to a class of drugs known as thiazide diuretics, or water pills. It's primarily used to treat high blood pressure, or hypertension, and edema, which is fluid retention associated with conditions like heart failure, kidney disease, or liver disease. HCTZ works by helping the kidneys remove excess sodium and water from the body, which helps lower blood pressure and reduce swelling. While hydrochlorothiazide is effective in treating these conditions, it may cause a range of side effects from mild to severe. The following side effects are relatively common and may occur as your body adjusts to the medication. 1. Dizziness, a feeling of lightheadedness or dizziness, particularly when standing up quickly. 2. Headache. Mild to moderate headaches are common during treatment. 3. Increased urination. Frequent urination as the body eliminates excess fluid. 4. Dehydration. Some individuals may experience signs of dehydration, such as dry mouth, thirst, or decreased urine output. 5. Low blood pressure, or hypotension. A drop in blood pressure, especially when standing up, can cause weakness or fainting. 6. Fatigue. Feeling unusually tired or low on energy, particularly in the early stages of treatment. These side effects are usually temporary and may resolve as your body adjusts to the medication. If they persist or worsen, consult your healthcare provider. Though uncommon, hydrochlorothiazide may cause serious side effects that require immediate medical attention. 1. Electrolyte imbalance. HCTZ can lead to low levels of potassium, sodium, or magnesium in the blood, which can cause muscle cramps, irregular heartbeat, or confusion. 2. Severe allergic reactions. Symptoms such as rash, swelling, especially of the face, lips, tongue, or throat, difficulty breathing, or severe dizziness may indicate an allergic reaction. 3. Kidney problems. Symptoms of kidney issues, such as reduced urine output or swelling, may indicate kidney dysfunction. 4. Gout. HCTZ can increase uric acid levels in the blood, which can lead to gout, causing painful joint inflammation. 5. Liver problems. Though rare, hydrochlorothiazide may affect liver function, leading to symptoms such as yellowing of the skin or eyes, known as jaundice, dark urine, or upper right abdominal pain. Hydrochlorothiazide is an effective treatment for high blood pressure and fluid retention, but as with all medications, it may cause side effects. Regular monitoring, including blood tests to check electrolyte levels and kidney function, is important for ensuring safe and effective use. If you experience any unusual symptoms while taking hydrochlorothiazide, contact your healthcare provider immediately. Always take the medication as prescribed and discuss any concerns or side effects with your doctor.
Before you go, don't forget to subscribe and click the bell to make sure you stay up to date on my videos.